Good afternoon, everybody. My name is Michelle Schuman. I'm a physical therapist here at Prairie Rehab in Sioux Falls, South Dakota. So with everything going on right now in the world, a lot of us are spending more time at home, but we still have aches and pains. It's harder to get out to your doctor, your therapist, or massage therapist, or whoever helps you with your pain. So today we're going to talk a little bit about ways you can take care of your arthritis pain at home. If you have any questions during this video, just put them in the comments section. Feel free to leave us a note and we'll answer them before the video is over. First of all, what is arthritis? Maybe you've been diagnosed with arthritis by your medical provider, or maybe you just have aches and pains and joints and you figure, oh, I probably have some arthritis from an old injury or wear and tear over the years. Either way, it can be very troublesome. Let's take a look at the word arthritis. Arthur is a suffix which means joint. And then itis means inflammation. Put it together, joint inflammation. And what arthritis is when you have one or more joints that might be affected. It is often worsened by age. Symptoms might include pain, swelling, redness, decreased movement, and stiffness. There are two main types of arthritis. One is osteoarthritis, the other rheumatoid arthritis. Osteoarthritis is primarily the wear and tear of the joint and breakdown of the cartilage of your joint. The cartilage is a thick, fibrous material that's on the end of your bone to prevent the bones from rubbing or grinding against each other. With wear and tear or injury, this cartilage can become damaged or worn down and result on that bone-on-bone grinding that a lot of people often talk about. Rheumatoid arthritis, on the other hand, is an autoimmune disorder where our body's immune system attacks the lining of our joint capsule. So each joint has a capsule around it, again, a fibrous tissue, and when our immune system attacks that and causes it to become inflamed, it can create pain and restricted motion of that joint. Arthritis can also be a result of other conditions that affect joints, such as gout, infections, psoriasis, lupus, or if you've had an injury in a joint. One question you may have is, how can I prevent arthritis from happening in my joints? Well, first of all, you can't always prevent it. Sometimes it's just a result of wear and tear of normal daily life. Some causes, such as increased age, family history, and gender, because women tend to have arthritis more often than men, they are out of your control. Those are things that we cannot control. If you're already more at risk to develop arthritis because of these uncontrollable things, then I'm going to give you a few habits you can do to try to control. One of these things is eating a healthy diet, exercising regularly, avoid injuries to your joints, and when you are exercising, choose low impact activities such as walking, bicycling, and swimming. To avoid injuries, avoid high impact things that involve jumping or jarring of your joints. Avoid twisting, heavy lifting, and activities or jobs that are repetitious or put too much strain on your joints. If you already have arthritis, protect those joints. Take rest breaks. Use adaptive tools. Alternate your activity levels to avoid that repetition or stress on your joint. Have respect for your pain and listen to what your body is telling you. If you do have arthritis, it's not going to go away. You just have to figure out how to manage that pain. People ask me, what can I do to decrease the symptoms I have for arthritis? Well, arthritis, inflammation of the joint, the first thing we want to do is decrease that inflammation. One of the easiest things you can do is utilize over-the-counter medications. You can use over-the-counter anti-inflammatories such as ibuprofen, Aleve, or Advil, or you can use a pain reliever such as Tylenol. Be sure to check with your pharmacist or doctor before taking any over-the-counter medications to make sure it's not going to interfere with your prescribed medication. And the other thing, be sure to follow the directions on the bottle to make sure you're taking them safely. Another thing you can do is utilize hot packs or cold packs. I have some examples here. This is a cold pack, a flexible cold pack that you just put in your freezer and you can use. And then this is a hot pack that has kind of some little beads in it that you can warm up in the microwave. They're really handy to use. So you want whatever you're using to be flexible, so you could put it around a joint to surround it. When using ice, if you have a more recent onset of pain and you're experiencing quite a bit of swelling, it might be better to go with an ice pack or a cold pack, okay? That will really help increase your circulation in the area and get that inflammation down. If you've had a longer lasting pain or a lot of joint stiffness, sometimes heat is more relieving. So you might want to try that. In either of them, you want to be sure to put something between the pack and your skin, to keep your skin healthy. And then you just want to use them for 10 to 15 minutes at a time. Every person has to figure out what helps them most. So cold, heat, whatever gives you the most relief, that's what you want to use. Another thing, like we mentioned earlier, you want to protect those joints. One of the things in protecting your joints is you want to use your larger muscle groups rather than small muscle groups to create less strain on those smaller joints. I have a box here that has some weight and items in it, and if I were to pick it up with just my hand like this, I'm using all of those small muscles around those small joints in my hand. It's a lot more strain. I can also feel it all the way up into my shoulder. So I want to pick up that box, and I want to put it on an open palm and support the whole box with my larger muscle group, my biceps. I want to give a shout out to Carla, my postal carrier, who's been delivering a ton of boxes lately because everybody's ordering stuff online. Way to go, Carla. Another good body mechanics tip is when you're lifting something. When you go to lift an item, you want to be able to use your hips and your knees, and you want to be able to kneel or squat to pick up that load. Keep that load close to your body when you carry it to, again, decrease the strain on your back. Another way to lift a box or load from the ground is to simply sit. So pull a chair next to what you're picking up, and then you're going to pick up the load, bring it to your lap, and then stand up from there. When you're doing a lot of sitting, you want to make sure your feet are well supported and you have a good support behind your back. If you do have armrests, you want to position them so they're supporting your forearms and elbows to make a good posture and have good ergonomics. Workplace ergonomics has become extremely important. Recently, many of us have had to move our offices to our homes and make a lot of changes with how we do our work. Be sure to stay tuned in the future for upcoming Facebook Live with one of our occupational therapists, Tim Myers, who's going to be talking about workplace ergonomics. Overall, when you give your joints a chance and you're not moving, they're going to get stiff. So you want to keep moving. Definitely keep moving. The more you sit, the more you're going to want to sit, and the more you sit, the weaker you can get. Arthritis can cause increased stiffness in joints, as well as limiting the motion that you have. So movement is improved by doing exercises, whether that be strengthening or stretching. Both of those things can be helpful. As physical therapists and occupational therapists, we, along with the Arthritis Foundation, recommend a balance of exercises, including stretching, strengthening, aerobic exercise, and working on our balance. It's been found that exercise can also help to boost your immune system, which we can all use right now. Here's a few dynamic stretches that you can use to work on some different joints. I'm just going to demonstrate some exercises. The first one I'm going to do is for your neck range of motion. Just to simply do some neck circles. You're just going to go in a circle, and you may want to do about 5 of these, one direction, and 5 the other direction, as long as they're not painful for you. If that's difficult for you to do the rotation movement, you want to work on your neck range of motion by looking down and looking up. Again, going through the full range of motion without increasing your pain. Probably do about 5 of those up and down. And then you also want to look left and look to the right. Again, nice slow movements, pausing at the end, going through your full range of motion as long as you don't have any increased pain. The next exercise are some arm circles. We're going to have our arms out at the side. Now if you have shoulder pain and you can't raise your arms to shoulder height, go ahead and have them down here a little lower. We're going to start with just small circles with our palms facing the ceiling. Do about 5 forward, 5 backward. And if that's comfortable for you, you can work into larger and larger circles. Again, doing about 5 forward and 5 backward. And that should help to loosen up your shoulders. Next, I want to work on the hips. So with your hip, again, you might want to hang on to something to be able to keep your balance. Maybe the back of a chair, like what I have here, or your kitchen counter is sometimes handy. And we're just going to do the same thing, a circle with our hip. So we're going to do a circular motion. Start with a small circle. Do 5 one direction, 5 the other direction. And if that's comfortable for you, you're going to go into a larger circle, and you can do that on both legs. Again, do 5 repetitions one direction, 5 the other. The next is a stretch for your low back. So we're going to sit down for this one. Sitting in a chair, we're going to sit forward on the front edge of the chair, and we're going to reach for the ground and let our back round so we can stretch out that low back. And when you get down as far as you can, you might not be able to touch the floor, but when you get down as far as you can comfortably, you're going to hold that for 10 to 15 seconds. And then when you come up, just straighten up real tall in a nice tall posture, and then go down again nice and slowly. Hold for 10 to 15 seconds, and come on back up. You're going to want to do about 5 of those. The next stretch is for your hamstrings on the back of your legs. A lot of times if you're having back pain, you also have tight hamstrings. So this is a really good one for not only hip pain, but back pain as well. You're going to put your leg in an outstretched position and point your toe up toward the ceiling. And then keeping your back straight, you're going to lean forward like you're bringing your nose straight forward toward your toe. When you get to where you're feeling the stretch on the back of your leg, you're going to hold for 10 to 15 seconds. I wouldn't want to see you doing this, because this can put more strain on your back and actually increase your pain. You want to keep that back straight as you're trying to stretch that hamstring. The last stretch we have, again, you're going to stay seated forward on your chair, and we're going to stretch our spine a little bit by doing some rotation. You're going to cross your arms in front of your chest, and then you're going to rotate all the way to your left and all the way to your right. And just pause at each end and move slowly. Again, moving through the full range of motion as long as you're not having any pain. If any of these create pain for you, please don't do them without consulting a therapist or your doctor. Besides the stretching, aerobic activity is often recommended. One of the best activities you can do is walking. It's a great exercise. If you're not a regular walker, you're going to want to start out slow. It's also an activity that you have to make sure your joints can tolerate it. If you have arthritic knees and hips, you might not be able to tolerate walking on land, but rather walking in a pool. When you're first starting out with walking, if you know you can walk, say, 8 minutes without increasing your pain, then that's where you need to start. It's not about distance. It's not about making it a mile. But if you do an 8-minute walk, so walk 4 minutes away from your home and 4 minutes back, and do that twice a day, you've done 16 minutes of walking instead of just 8. just build up from there. Once you can do that comfortably, you can increase your time and therefore your distance increases. Make sure you're wearing well-fitting, supportive shoes and be creative with your walks. Try different routes, maybe meet up with someone, as long as you continue to socially distance, and even mix things up a little bit when you're doing your walk. You can do some additional strengthening and balance challenges by doing some marching, just marching with some high knees for a short period of time. Or do what we call monster steps, which is taking great big steps like you're trying to step over a puddle as you walk. There's a lot of ways you can be creative, and it helps enhance your strength and your balance. Rule of thumb with any activity when you have arthritis is, if it hurts, don't do it. We're not out there to aggravate the pain, because then you're starting that inflammation all over again. We want you to do things that are comfortable for you and that you can do and be mindful of your arthritis pain. So when dealing with arthritis pain, the do's are: walk in the shallow end of the pool. Walk on level land or on a treadmill without an incline. Swim laps using just gentle kicks. Ride a stationary bike or a regular bike, but in easy gears. Again, try to avoid the hills and stuff where you have to really tax your joints. Good stretching exercises are by doing yoga and Tai Chi. Again, you want to do things that protect those joints. Don'ts would be stay away from running. Don't run. Don't do squats or heavy lifting. If you're doing a mini squat or a body weight squat with instruction to make sure your technique is correct, it's okay to do those as long as you can do them without increasing your pain. But for the most part, avoid any squatting with heavy lifting. Also avoid sports that have impact or jumping, as these can really pound on your joints. And then when you're out walking, try to stay off of uneven surfaces. And then if you're walking long distances, make sure there's places where you can stop and rest periodically. You don't want to overdo it, because that's when your arthritis pain is going to flare up. Some of my patients will ask me, so when do I go to the doctor? If you have joint pain and think you may have arthritis, you should contact your medical provider. Talk to them about your pain and treatment options. You should especially contact your doctor if you've been doing home treatment yourself, trying to take care of that pain, and it hasn't gotten any better for you. Also, if you're having pain such that it's interfering with your daily activities, or it's really limiting your movement, and you're noticing it getting worse, definitely contact your doctor. So, how would physical therapy or occupational therapy help? Well, physical therapists and occupational therapists do many different things that can help reduce your inflammation. We do this by using modalities, manual therapy, exercise, and instruction to help you improve your body mechanics. A physical therapist or occupational therapist would help to isolate the cause of your pain and what's triggering it to flare up for you, so we can help you modify things and manage that pain so it's not constantly interfering with your daily routine. We individualize the treatment to your needs and the goals that you have. If you used to be a walker and now you can't walk, and we want to help you manage that pain and figure out whether we can get back to walking or need to modify to another exercise to keep you active. So I hope I've answered a few questions you've had. Are there any other questions out there? If so, just put them in the comments below. I hope this has provided some useful information for you on how to manage your arthritis pain. If you'd like to get in touch with us or think of a question later, you can do so by phone, email, through Facebook, or on our website at www.prairierehab.com. We also provide free 15-minute screens where you can talk personally with a therapist by phone or in person. So if you're interested in that, please give us a call. We're here to help you, so let us know how we can help you. Tune in next week, again on Tuesday and Thursday at 1 o'clock. We're going to be doing more Facebook Live from Prairie Rehab. So in the meantime, remember to keep moving every day.